Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Vice President Biden presented his report on the Cancer Moonshot initiative this week, which calls for increased information sharing and a $700 million investment from Congress. Biden said he has witnessed more collaboration since the project began, but that much more needs to be done. The report calls for more incentives to reward collaboration, better recruitment for clinical trials, faster sharing of both patient information and discoveries. Several research efforts have started under the Moonshot Initiative, including a partnership at the National Institutes of Health to bring together cancer research centers, foundations, philanthropies, and drug companies to share data. For more on the Cancer Moonshot, visit ajmc.com. Physicians and healthcare experts around the country spent this week reading the details of the final rule for MACRA, the Medicare Access and Chip Reauthorization Act. Many praised CMS for listening to concerns that the rule as first proposed would have threatened the survival of small and rural physician practices. As the final rule was announced, Dr. Kate Goodrich, Director of Quality Measurement and Value-Based Incentives at CMS, explained the approach that regulators took in protecting these providers from too much upheaval as they transition away from fee-for-service.
The one thing that has come out that people are concerned about naturally is how this impacts the individual solo practitioner as well as clinicians that are in small group practices. And these are very dedicated, hardworking clinicians who want to provide the highest quality care to their patients, and undoubtedly they are doing that. But the work that has to happen to be able to report on that work and the quality of the care they provide is not a small thing. It is not trivial. And so we worry about that too. We worry about those practitioners too.
Complaints filed with HHS charged that 7 health insurers are discriminating against people with HIV and other serious illnesses by making the drugs they need unaffordable. Harvard Law School's Center for Health Law and Policy filed complaints with HHS's Office of Civil Rights, saying the insurers are trying to avoid parts of the Affordable Care Act that bar marketplace plans from creating benefit designs that discriminate based on age, race, gender, sexual orientation, or illness. While regulators don't define such designs, they've suggested that pricing single tablet regimens that are standard of care out of reach would meet the test. The center filed complaints against Humana plans in 6 states, against Cigna plans in 3 states, and against 5 other insurers in Pennsylvania, Wisconsin, and Texas. Pfizer said this week that its biosimilar Inflectra, similar to Johnson & Johnson's TNF blocking agent Remicade, will cost 15% less when it reaches the U.S. wholesale market in November. Said Pfizer's Diem Nguyen, by introducing Inflectra to the U.S. marketplace, Pfizer is helping customers access an additional high-quality treatment option that promises greater savings for the healthcare system. Inflectra was approved this year to treat rheumatoid arthritis, Crohn's disease, psoriatic arthritis, and plaque psoriasis. Without insurance or discounts, a single dose of Remicade can cost $1,300 to $2,500, depending on a patient's weight and the disease being treated. Johnson & Johnson said Pfizer's move would be an at-risk launch, giving ongoing litigation, but that it would compete with discounts, rebates to payers and pharmacy benefit managers, and other options. There's a lot in the news these days about surprise bills that patients receive if they venture outside narrow networks for care. A new study in the current issue of the American Journal of Managed Care shows that few patients try to negotiate bills, and they're not too successful when they do. The Internet survey found that only 19% of patients tried to negotiate out-of-network bills and succeeded only 56% of the time. If there's a lesson in the findings, patients had more luck working straight with the provider than the insurer. For the full study, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.